Good morning. Welcome to Let's Talk on the Second Chance. My name is Philip Jones.
And I am Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches, where we coach people with stage 3 to stage 5 kidney disease. If you or you know someone who has kidney disease and needs to be coached on their challenges, hit us up at kidneycarecoaches.com.
So today we have kind of a part two to yesterday. Yesterday we did 5 symptoms that you need to know about low hemoglobin. Today we're going to do the symptoms, causes, and treatments of low hemoglobin. So to start, what does low hemoglobin mean? Hemoglobin is the protein substance found in red blood cells, which is responsible for the transport of oxygen from the lungs to tissues and carbon dioxide from tissues back to lungs. It is made up of four protein molecules, uh, globulin chains that are joined together. So basically, that just kind of touches on pretty much what we talked about yesterday. Uh, your oxygen and being able to breathe correctly. Shortness. We talked about shortness of breath, things of that nature yesterday as well. That's connected to it, and with symptoms and stuff. So, like it tells you basically um, the functions of what hemoglobin is and how it plays a major part in our body. So, um, we're gonna get through this, try to be as informative as possible. So, Mr. Cook.
Yeah, man, that's very, very important. I'm gonna talk about right here some of the symptoms and signs, and I'm just going to read them off real quick. The symptoms and signs of low hemoglobin depend on the cause and seriousness of your condition. In some cases, there might be no symptoms, signs and symptoms if they do not occur. Might include, but some might include weakness, irregular heartbeat, headache, cold hands and feet, pale, yellowish skin, fatigue, dizziness, lightheadedness, chest pain, shortness of breath, um, retarded growth. So you might in kids that you might not see them growing big enough because they're not getting a lot of blood.
Right.
And they say anyone can have low hemoglobin levels. However, the following people are more likely to experience it. So I'm just going to talk about a couple, like some of the people. So women because of the loss of blood because of their periods and childbirth. Uh, People older than 65 because they're a little older and their iron deficiency, and they
Right.
might not have a lot of iron in their bodies and stuff like that. A lot of times, people can't absorb iron. Where they just can't absorb iron. So that you might see that in people like that too. And people that use a lot of blood thinners because their blood might be just too thick or something like that. They might use it for blood pressure or for some other reason, but you might see that in them also. And people with kidney failure. Why? Again, because the kidneys help produce hemoglobin. Go ahead, Phil.
Yeah, definitely. Something that you just mentioned is important. People who are taking iron supplements and things of that nature, right? Go back, check your labs, because more than likely your doctor probably told you when he prescribed the iron to you that your hemoglobin was low. 9 times out of 10, that's the reason why doctors prescribe iron pills and things of that nature for their patients is their blood cell count. So definitely go back to it. Keep track of it. You know, um, try to make sure that the ones that you're working. And here's the other thing about that is something we talk about a lot is being your own advocate, right? If you see you're taking a certain amount of iron pills a day, but it's not really helping, go do your research and see if there may be another type of iron pill that you can take that may be more effective, or something like that. And I'm not saying just go buy it or anything like that, but go back to your doctor and say, hey, um, I found these, iron pills. They said they're a lot more effective in blah 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 area or whatever. Can you look into it? Let me know if you think this is good enough for me to take. I wouldn't mind buying these if I needed to or whatever. And the reason why I brought that up is because that was kind of what I did with calcium pills. I hated taking those calcium pills that they had me taking because they felt like rocks going down, and I have to take so many. So what I did was I found some gel pills at a store called Sprouts, which is very similar to Trader Joe's and stuff like that. Those types of stores. I took it to my nutritionist. I took it to my pharmacist and my physician, and showed it to them so they can go through dietitian can go through, what's to make sure it's all pure. The pharmacist to make sure that it's equivalent to the ones that they wanted me to take, and then also for my doctor to make sure that it will be effective for what we needed it for, what needed it for, and it's not going to affect any other areas of my health. So definitely be proactive. So it says so that another thing connected to low hemoglobin is anemia. So it says there are several types of anemia. Some cause mild conditions, while some lead to chronic medical conditions. The different types of anemia come from the following factors. The body cannot synthesize enough hemoglobin. The body synthesizes hemoglobin, but the hemoglobin does not function properly. The body does not sympathize enough red blood cells, synthesize, sorry. The body degrades red blood cells faster than normal. So these things I just read are similar and different all at the same time. Um, not being able to degrade, blood red blood cells are important. Not able to synthesize uh, those red blood cells as well. So um, it's 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 something that you need to know. I'm sure doctors look at, but definitely do your own due diligence and try to make sure that you aren't dealing with these things, and also be honest. When you feel a certain way, because you might be feeling a certain way and think it's nothing or don't listen, and it could be the connection to a low hemoglobin. So, but go ahead, Mr. Cook.
Okay, I'm gonna go to the next one. Causes for low hemoglobin. We'll talk about that. Some of the causes can be a disease. It could be also, kidney disease is one of the main ones. Heart disease can be a challenge with that too. But I'll read right here in different medical conditions. Diseases that make the body synthesize fewer red blood cells than normal are aplastic anemia, cancer, lead poisoning, multiple myeloma, leukemia, non-Hodgkin's lymphoma, and rheumatoid arthritis. Those things can. I'm gonna read a couple more too. Psoriasis, chronic kidney disease, iron deficiency, inflammatory bowel disease. There's a lot of conditions right there that will, and what he means by downgrading the iron, the red blood cells is some of these diseases kill off the red blood cells. They don't let them develop and help your body. And that's why, you might be anemia in some of these areas right there. So that's what they're talking about. Okay. And right here it says a low hemoglobin count can also be caused by blood loss, which can happen because of bleeding in the digestive tract. Now, I remember when I was on dialysis, they said I had internal bleeding. Now, they took a scope and they went down this way and they didn't find it. Then they went up the other way. That's what they do because they're looking for internal bleeding. And they couldn't find it. But yet still my hemoglobin was dropping considerably. So they was always giving me EPO and everything. But eventually it cleared up on its own. So who knows? I might have had some internal bleeding that they didn't see and stuff like that. So that could be a challenge also with that one too. Go ahead, Phil.
Yeah, something that you brought up just now, right? Them checking to see if you had internal bleeding. So one thing I found out, because I dealt with that same thing, they had to check, you know, check me as well, to make sure that there was no, bleeding going on internally, is that for people like us that take pills all the time, right? What happens is, after taking pills so many times, for so long, what can happen is that it can tear the inside, which causes blood to leak and things of that nature. So, but what can
Yeah, it's the
also
stomach
happen in that
wall.
process,
What happens is you get
right?
an ulcer in the stomach wall, and the ulcer can thin out the wall because you take some high dosage medications. That's what Phil's saying, and it can give you internal bleeding. And he's exactly right about that. Go ahead, Phil. I'm sorry, I just wanted to
No,
clarify
you
that.
good. But not only the stomach walls, but your esophagus, it
Yep,
going down can cause it.
yep.
Uh, but the thing about that is that it can actually heal quickly as well.
Mhm,
Because I dealt with, I had, they were kind of worried because they were seeing that I was having, I had low hemoglobin. They noticed that it was like, uh, blood, in places it shouldn't have been during tests and things of that nature. And so they, when they checked it, they can see and tell. They said, they came and told me, you probably just had some tears in your walls and things of that nature,
mhm,
from taking
mhm,
all these medications. 'Cause I take a lot of medications daily.
mhm.
So it is definitely something that can happen. Um,
Right.
let me see. Next is bone marrow and stem cell conditions. Uh,
Yep.
so it says blood, marrow, and stem cell conditions may prevent the body from producing enough red blood cells. Some of
Mhm,
the stem cells in the marrow, the center of your bones, will develop into red blood cells. If they are not enough, or they have replaced by other cells such as cancer cells, then you can have low hemoglobin count. Low hemoglobin level caused by bone marrow or stem problems include aplastic anemia. It can happen when there is insufficient stem cells or complete absence of stem cells in the body. People can have aplastic anemia because of their genes, or because their bone marrow is injured by medications, radiation, chemotherapy, or infection. Other conditions that can affect the bone marrow are multiple myeloma or leukemia.
mhm,
In most
mhm,
cases, there is no clear cause of aplastic anemia. Lead poisoning. Lead is toxic to the bone marrow, causing people to have smaller red blood cells. Lead
yep.
poisoning can occur when adults are exposed to lead at work. It can also occur when children eat chips of lead paint, which is why they tell kids not to put toys and things that nature in their mouth, because that's where they can develop that lead poisoning from. Are those little, like, toy cars and things of that nature that kids play with. um, Thalassemia. This causes this occurs when there's with hemoglobin formation. The fourth chain not correctly formed. The body makes really little amount of red blood cells through the body. I'm sorry. The body makes a really little amount of red blood cells, though the body can produce enough of them to be asymptomatic or can be severe. So you see how,
Yes.
when we talk about red blood cells in general, it's important, but you see where all these things can be effective. Like I said, lead poison. That's just a big reason. Again, why they tell you, again, like I just said, about kids playing with toy cars and plastic Legos and things of that nature, like that. That's where most kids get lead poisoning from. Or, because they're kids. Every kid's done it. Every kid has been playing with toy cars, and all of a sudden it ends up in their mouth, and you're like, well, how did that happen? So definitely pay attention to those things when it comes to youth. I'm sure there's a number of ways that adults can get it. Because first off, I don't think no adults putting toy cars in their mouth, but uh, if you are, we gotta figure something out for you. So, but definitely, do that research of finding out things that or potential lead poisoning things that can be around you in your life that's effective. Go ahead, Mr. Cook.
I'm just gonna talk about. You're right about that, but I was gonna stress about talk about I work with a patient who was a bone marrow transplant recipient, and that was the first case I had ever worked with somebody who had bone marrow. I was always used to working with people who had organ transplants, but this was the first one, and they had to give him blood like multiple times. And why? Because of his body was not absorbing the iron, and the hemoglobin was really low. So I just wanted to stress that. But these are some these are some symptoms and treatments for low hemoglobin right here. And we're going to talk about it. Increasing your iron and foliate intake. That's what we talked about, the green leafy vegetables yesterday, the kale, spinach, and things like that. A person with decreased levels of hemoglobin can see improvements by consuming more foods with high iron content. Iron helps to increase the production of hemoglobin, which helps to form more red blood cells. Foods rich in iron are meat, fish, peanut butter, green leafy vegetables such as kale and spinach, broccoli, eggs, nuts, seeds, soy products such as tofu and edamames, dry fruits such as figs and dates, and green beans. Remember, now, we want to just put this out there. If you are on dialysis, you might want to check with your nutritionist to see what you can eat, what you can't eat, because some of these foods might have high potassium. So you want to be conscious of that. I just wanted to say that, okay? Foliate is a type of vitamin B that plays a vital part in hemoglobin production. You know, your B12s, your B6s, those are really big to keep the hemoglobin up high. Okay, the body utilizes foliate to synthesize hemo. Hemo is which is blood, a component of hemoglobin that helps to transport oxygen. If a person is unable to get enough foliate, then the red blood cells will be unable to develop, which can lead to foliate deficiency, anemia, and low hemoglobin levels. Good sources of foliate include beef, spinach, rice, peanuts, lettuce, avocados, green beans, black eyed peas. Remember, I just want to say it again. Check with your nutritionist if you have other challenges as far as kidney disease or if you're on dialysis, something like that. Why? Because you want to make sure these foods you're eating don't have high potassium because that could be a challenge for you on dialysis. Go ahead, Phil.
All right, I'm gonna end it with reading these little small little couples and paragraphs real quick, and then we'll get out of here. It says maximizing iron absorption. Consuming iron in foods or supplements is important. However, you should be able to absorb the consumed iron. Foods rich in vitamin C, such as citrus fruits, strawberries, and leafy green vegetables, can increase the amount of iron absorbed. And consuming a vitamin C supplement can also help. Vitamin A and beta carotene can help the body in absorbing and causing iron. Foods rich in vitamin A include fish, squash, kale, and collards, liver, and sweet potatoes. It is possible to increase your hemoglobin level through changes in the foods you eat and supplements. It is important to talk to a doctor to help treatment, especially when the condition is severe. So basically, everything in this conclusion, for the most part, we talked about in the past 2 days. We talked about the leafy
Mhm.
greens that you can eat. We talked, went over a couple of things with the vitamins and things like that we can uh do. And then the main thing is definitely, even when you're trying to find a second opinion on things, whether it's yourself or from another doctor or physician, always go back to your original physician and consult with them to make sure that these ideas and things like that are right for your health. Because you may be hearing, okay, yeah, it's good for this, but because a lot of these things are specific, may have a connection to something else that you may be suffering with medically as well. So definitely go back to your doctors, converse with them, make sure that you put yourselves in a good position to use these alternative methods to be able to help, whether it's hemoglobin, whether it's your cholesterol, anything like that. Always go back to your doctor and talk to them. Mr. Cook.
Again, man, I think some of these things were really, really important. There was a lot of stuff that I learned also on here. One thing that was really, really prolific on here was you can control these things by food, but again, like Phil said, we can't stress enough that you go back to your nutritionist or your doctor if you have another challenge. So just listen to this information is great, but again, you might have a problem that might be totally different than this, why your hemoglobin might be high or low, but you definitely want to go to your doctor. Other than that, I'm out.
Awesome, awesome. Appreciate you, Mr. Cook. We'll be back
Appreciate
tomorrow.
you.
Tomorrow morning. We'll go with a topic we were gonna go with today, but we end up, going with this part two of hemoglobin, which is the top foods to take for your kidneys, or top foods to eat for your kidneys, and we look forward to going through that tomorrow. So you guys have a wonderful Wednesday, and we'll see you tomorrow morning.